Ben, there was a question which slipped my head about 10, 15 minutes ago. When we're talking about these overdose prevention centers, I feel like it's almost the birth of creating a virtuous cycle of positivity, of getting people out of a rut. What is some, do you think there's other infrastructure? What other infrastructure should be perhaps put around to maybe help rebuild this person's life?
Yeah, I mean the number one thing um, is housing. I think housing is a huge issue, and I think where you see cities that have problems with drug-related death, there's often huge problems with homelessness and a lack of housing. And there's a really fascinating approach which is now starting to be implemented in the UK, but is widely used in Scandinavian countries and a few other European countries, but it's called Housing First. So in the UK, if you present to the council as being homeless, you get put into a homeless hostel. Often you'll have to stay there between anywhere from 1 to 3 months, and you'll be in a hostel with maybe 50 other people, often sharing these big kind of bunk rooms. And over those 1 to 3 months, you have to prove that you can make your meetings and you can kind of abide by all these very paternalistic rules around drug use. And there's all these barriers. So if you're using drugs, often you won't be granted access to these shelters, these sorts of things. And then you'll maybe get into transitional or temporary housing. And then after maybe a year, you'll get your own stable, permanent place to live. And Housing First completely flips that and says, regardless of kind of your drug use or maybe problems with mental health, regardless of that, the foundation to a stable life is having your own home. And so from the
Mm.
outset, they give people their own apartment. And kind of the results from evaluations of these programs have been incredibly successful, showing that people actually, when they get home and they have a stable base, they're then able to progress into job training and employment and reduce their drug use and make their appointments. And so when you ask kind of what is something that needs to go alongside harm reduction and effective harm reduction programs, for me, housing is the number one thing. And people just having the dignity to have a roof over their head, not being treated kind of like cattle and shoved into a room with 50 other people. So yeah, for me, it's housing. If you ask what the
Yeah.
number one thing is.
Yeah, I guess that goes back to the earlier points which we're talking about, which was a philosophical question of how we view drug abusers and people who need help. And I guess for worry on my part is if we're asking parties to commit taxpayers' money to funding these kind of programs, I personally think there'll be a big backlash from society. What do you think?
Yeah, and I mean, I think that's what we touched on earlier in terms of it's not a vote winner. I think kind
Yeah,
of putting I mean all of these programs like Housing First and OPCs and these sorts of programs that show long-term cost savings, there's money that needs to be injected up front. And I think that that's a number one kind of that's the number one barrier is that these programs oftentimes they are long-term necessary long-term solutions, but our political cycle, which operates in 4-year cycles, like governments don't have time to see a program work over 10 years. And so I think that's a real struggle. I think also something that I haven't touched on yet is language. And
right.
I think that kind of for destigmatization, I think that kind of the decriminalization of drugs is the most important thing, but also just the language that gets used in the media and by governments, even by people like us who are having discussions that will then get listened to. I think referring to people using people-centered language, so people who use drugs or people who people who are dependent on drugs, people who use drugs. I think it really kind of changes the narrative as opposed to words like addicts or kind of even something like drug abusers, for example. I think that terms like that really work to kind of enforce this narrative that kind
Yeah.
of a moralized narrative that it's someone's fault. And yeah, so there have been huge pushes recently to get changes in language, and that's actually been taken up really successfully. So that's good to see.
Yeah, in terms of breaking that stigmatization, I think even something as simple as like what you described earlier, of actually going to these places and meeting these people in person and seeing where they take drugs and actually seeing that their life is falling apart for various other reasons is probably, I think, the most powerful force in terms of how to flip the perception that people have of these drug users.
Yeah, 100%. And I think also just kind of getting it out there that the majority of drug use in society isn't problematic. Um,
Yeah,
is it will also kind of help change people's perception on it. Because when you think of someone drinking alcohol, your first thing that comes into your head is maybe someone drinking in a bar or drinking with friends. Like the thing that we have associated with alcohol isn't immediately problematic alcohol use or someone ruining their lives because of their alcohol use. But
yeah,
when you say to someone, "What do you think of when you picture a drug user?" Immediately, it's someone injecting heroin on the street.
yeah.
Um, and I think that all of these things, kind of the changes in policy and overdose prevention centers, and kind of this more humane way of treating people who use drugs will help shift this narrative towards kind of a more accepting kind of public health centered
Mm.
view.
Yeah, it's interesting. With alcohol, we've learned how to regulate it. We put the precise amount of units in a bottle that generally is not enough to kill you. We know our limits. We could do the same with drugs, whether it's MDMA, whatever drug it may be. I think there's certainly scope to do that. I'm not sure if there was a study, not a study, there was, I think, an experiment done over a summer at a festival in Bristol called Boomtown.
Mm,
And what they did at this festival, they had these clinicians come in, and they offered to test your drugs for you
mm,
to test for potency. And I think there are some really outstanding results where, if I think they managed to show that like 60% of the MDMA was 5 to 10 times um, the potency of what is actually safe to take. And these people actually just ended up saying, "Oh, okay, I don't want to take it anymore. You, I don't want to harm myself with these lethal drugs which are being produced in the illicit market because they're not regulated." I think this is a really interesting way to move forward.
yeah, definitely. I mean, that's sorry, I should have touched on that earlier. Drug testing is another brilliant form of harm reduction. Because first, I mean, people are then able to identify what's in their drugs and not take it if it's not what they expected. But also, what you see is that kind of behavioral changes. People don't want to go out and get get and people don't want to go out and die. Basically, people
No,
don't want to go out and or even people don't want to go out and ruin their time at the festival. Everyone's doing drugs at festivals because they want to have an enjoyable time. They want to have fun. And so
yeah,
what you're doing by having drug testing there is acknowledging, okay, most people coming to this festival are going to use drugs. In fact, the only reason that this festival is operating is because it's where people like to take drugs. So just
hmm,
being upfront about that in the first place, I think, is would be really, really helpful. And then
yeah,
secondly, acknowledging that every single year in the UK, people die at these festivals from completely preventable deaths. It's things that can be completely avoided. If people
mm,
know what's in their drugs and they can kind of use correct dosages based on the information that they have, it makes everything a lot safer. And I think even just things like kind of having dogs, the sniffer dogs at the front of festivals, those sorts of policies are shown to do absolutely nothing in terms of stopping the amount of drugs go in. And all they do is make it much more dangerous for people because people are then in the queues, they see the dogs, they take all their drugs at once. And a lot of the drug related hospitalizations at festivals actually come from this first point of contact with festival authorities when they're just taking all their drugs in one go because they're scared of getting caught. So imagine what could happen if instead of having that, instead of playing this false game of these dogs actually going to do something in terms of reducing drug use at the festival, you have harm reduction stations in place with trained clinicians. You can test the drugs there. It's just a much more sensible way to approach these sorts of things. And I think it is getting more and more like that. There's an organization called the Loop UK. I think they're the ones who actually did the festival at Boomtown. But they're now starting to go around to festivals every summer in the UK and implement these services.